Hello, everyone. My name is Stephanie Boozer, and I'm with CUGC HQ, and I'd like to welcome you to today's user share brought to you by the new Healthcare SIG. This is going to be a case study with Novant Health, talking about how Imprivata and Citrix help provide a secure environment. Our presentation today will include a live Q&A after everything is all done. We will ask you to put your questions in the question area of the GoToWebinar control panel, and we'll keep an eye on those and ask those following the presentation. Also, I want to let you know that this presentation is being recorded and will be posted on mycugc.org afterwards. Again, just a reminder that today is brought to you by our new Healthcare SIG. If you are not yet a member, we'd love to have you join. And I will put a link up in the chat window later in the webinar so that you can go online and join as soon as possible. Our presenters today are Dan Schlimme and John Willauer. Dan is an Enterprise Systems Architect with Novant. He's been there for more than 8 years and is both expert level certified in virtualization and professional level certified in NetScaler. He manages a Citrix farm that includes an Epic on XenApp deployment with an impressive 15,000 concurrent users daily. Additionally, his environment uses 4 HA pairs of NetScalers for GSLB, local load balancing, and remote access. John is also with Novant Health. He is Senior Systems Analyst and is the Imprivata Administrator. He has been instrumental in the implementation of Imprivata and fine-tuning its use within the environment. And with that, I will turn things over to Dan and John to get us started. And I'll send you the screen, Dan. It's coming right your way.
Great. Okay. Hey, everybody. Hope everybody's having a lovely day. What we're going to talk about today is our use case with Imprivata and Citrix. I know there's been some other webinars out there in regards to this particular environment and setup, but as we all know, each individual location has its different needs and different configurations. Let me give you a little background on Novant Health here real quick. We're a non-profit healthcare system. We're located in North Carolina, South Carolina, Virginia, and Georgia. 24,000 employees, 15 medical centers, 436 physician clinics, just shy of 1,400 physicians, and total we have a licensed bed count of 2,585. So we're pretty spread across multiple states and have a wide variety of healthcare medical centers and physician clinics, large and small. Our website's right down there at the bottom if you'd like to check us out. Some people might be interested in that. So when we started looking at single sign-on solutions, we went through a kind of a gambit of different things. We looked at different options of Centillion, which is now Paradigm, and then we came on to Imprivata. And one thing that we'll touch on a little bit later is that Imprivata, the use of it as far as configuring the environment was much easier compared to anything else that we happen to see. So our objectives here were essentially to identify areas where the workflow can benefit from a single sign-on solution. Myself, I have my own opinions of single sign-on. Physicians have their own opinions as to what needs to be done. So what we really had to do was look at all the environments and figure out what's going to be the best. As I mentioned, we evaluated some single sign-on products to determine the best fit for our environment. We also needed to implement the single sign-on solution seamlessly into our existing workflows. And seamlessly is pretty key there. To move to this, there was some change, but we had to make it as seamless as possible. And then John did a great job with doing that. As everybody on the phone probably knows, when you're working in healthcare, physicians, nurses don't like change, and it's that big hurdle to overcome, even if it's for the better. we needed to make sure that our environment also protected our patient information. So we needed to ensure that we were going to be locking stations whenever we needed to, and that when users moved from device to device, they weren't pulling up other patient data or anything along those lines. And finally, ensure staff is happy. That's really one of the more important ones. If they're not happy, they will kind of revolt and not want to use the products that and the workflow that we have built for them. Okay. So this is just kind of an overview of our environment. So from a end user perspective, we have a combination of thin clients, HP, both HP and Ys, and we use the 510s and the 610s. And for Ys, we use the 5000 series. Now, where they are, it really determines when they were rolled out. As many organizations do, they have a brand that they might have a deal with, or a brand that they originally started with, and then they migrate to another brand. That's essentially what happened here with our Ys and our HPs. Our desktops and laptops, the desktops are all pretty stationary. A lot of the laptops, in all fairness, stay pretty stationary as well. Those laptops are also used for what we have is, I call them cows. Some people call them for a computer on wheels. Some people call them CAC or COCs, computer on carts. It's kind of interchangeable. And we also have each device is logged into with a generic ID that is logged into Windows and into the receiver itself. Now, each device, as thin clients and the desktops, we do have some laptops that have individual users that log into it. But the majority of what we're going to be focusing in on is our thin clients and our desktops that have a generic ID logged in. And we'll touch on that a little bit later, but that has to do with roaming constraints that we had. Our Citrix environment, we have XenApp 7.6, and that is specifically for our Epic environment. As you can see, our EHR is Epic 2010. We have a 1-hour idle time and a 3-hour disconnect, and that just basically allowed sessions to stay up and allow users to come and go from a specific device without being locked out. We also have published applications. We don't do any VDI in the environment at this moment. We also use Storefront 3.0 and Receiver 4.3, and that's across our entire environment. And we have EHR. It's Epic 2015, which we just upgraded to earlier this year. We actually did a migration from Epic 2014 to 2015 and XenApp 6.5 to 7.6 all at the exact same time. Epic itself has a 20-minute idle timeout that will lock that session, and we'll get into that a little bit later. And this is actually the constraint that we had for roaming, and we'll touch on that a little bit later. But there is no roaming within our Epic Citrix session. And for our Imprivata configuration, I'll let John talk on that just a little bit.
Yeah, in our Epic environment, we have, like Dan mentioned, we have both shared and private computers out there. The shared has the generic IDs logged into them, and the private are all laptops that are assigned to individuals that they log into Windows with their own credentials. On the shared workstation, we have what's set in Imprivata 1-minute idle timeout without Epic open. What that means is if a person logs into Imprivata with their credentials but fail to open up Epic, after 1 minute the screen will fade and then lock, and then they'll have to log back in. But if they're logged into Epic, the timeout expands to 10 minutes before the screen fades and locks. The reason we did that, we had issues with people failing to log in or to lock the workstation before they left, and it left the patient information exposed, and also exposed the computer to being used by someone else. And so you have them logging and charting the Epic with the previous user's credentials. We're using both fingerprint readers and badge readers to authenticate into Imprivata. Our acute facilities all are using the badge readers, and our ambulatory clinics are using the fingerprint readers. current version of software, with Imprivata, we have to install the Epic connector onto each of the Epic Citrix servers, and you see the version there. The Imprivata client on endpoint devices, we have both right now 4.9 hotfix 7 and 5.1 hotfix 5 out there. As we have issues with any clients with 4.9, we're upgrading them to 5.1 at this point. We have 4 production appliances, and they're all on 5.1 hotfix 13. And we have also in our environment a test appliance and a development appliance, which allows us to test and develop stuff without impacting the production environment. We're right now getting ready to kick off a project to upgrade all of the environment to 5.3, and we should be starting that up actively first part of January after the New Year's, and hope to have it done by the end of April.
As John talked about with the timeouts within Imprivata, that was pretty crucial to our environment, because a lot of our environment is a shared workstation. So we did need to ensure that if a user walked away, that the session would lock and time out appropriately, but you didn't want it to time out if Epic was open in the event that you're working with a patient. So I think that was a workflow that he had to figure out to find a good kind of good medium. Also, in the event that the session didn't lock or Imprivata didn't lock, Epic would also time out and lock itself. So it would take you to a secured workstation, which I believe we'll have a photo of here a little bit later, so that anybody who came to that device would have to re-authenticate in.
Okay, this shows the 2 methods of authenticating into the workstations. The one on the left is the fingerprint reader, and any computers that have a fingerprint reader attached will see the screen up top that prompts to lay your finger on the fingerprint reader. Now, if a person hasn't enrolled their finger, or they can always hit the cancel button, and they'll see the screen basically to the right on the top there, when they can manually enter their credentials. So they're not required to enroll their finger if they don't want to. And same with the badge reader, they just tap their employee badge on the badge reader and it'll log them in. Now the way it works, we have it set up here with the fingerprint reader. First time they lay their finger down for the day, they have to enter their password. And for the next 8 hours, no matter what computer they go to, when they lay their finger down, they will not have to put their password in. So it saves them quite a bit of time from having to enter their credentials all the time. And with the badge readers, like those are in the acute facility, we decided with those, it'd be every 4 hours that they have to re-enter their password. And one of the reasons for that is you're more likely to lose your badge than you are your finger. At least that's the hope. So.
Did you have any troubles with users getting used to this workflow?
With the badge readers, we had a little pushback, but once we showed them how easy it was and the benefit of not having to enter their password every time they walked up to the workstation, it was widely accepted. They realized the huge saving in time of having to enter their credentials every time.
Is there a specific reason why you have the badge readers at the acute facilities versus the ambulatory?
The reason with the fingerprint readers at ambulatory is at the ambulatory clinics we were introducing the electronic prescription of controlled substances, and that required a fingerprint reader or the badge reader, and so we were able to dual purpose the fingerprint readers for both EPCS and authentication.
Cool. So that's just another way that it allowed us to be more secure, so that you do have to prove it's you. Anybody can take your badge, like John said, and it's very easy to lose your badge, but you're probably not going to lose your finger. So this is an example as to what our users would see once they log in. So each desktop is pretty much identical to each other. This is an example of one of our thin clients. Each time a user logs in, they're prompted with our receiver screen here, and we've auto-enrolled the users into hyperspace PRD, as you can see right there on the right. And what that is they just cut down on the amount of clicks that the users would have to do. They don't have to go in and subscribe to anything. On top of that, you also see up to the top left-hand corner that we have an icon on the desktop. Most of the time, the application is already open. Users aren't needing it, but this at least gives the opportunity for the user to have multiple ways of getting to the application, which seems to make their life a little bit happier. You also notice in the bottom right-hand corner, I know it might be a little hard to see, there's a red Imprivata box. It's the, if I can point to it here. It's right here. And what that's essentially doing, and John will talk about this too a little bit, that's essentially reaching back to the appliance of Imprivata, confirming you are who you are, and basically storing those credentials that does get sent into Epic itself. Is that correct? Correct. So, now, as I mentioned earlier, we don't have a roaming workflow, and the reason for that is Epic. So one thing I wanted to stress is when we roam within a Citrix environment with the use of Imprivata and the APIs into the receiver, everything worked flawlessly. Our applications roamed, users were reconnected within a second or two. Everything worked perfectly. An issue that we ran into was hyperspace specifically. There's tabs and use cases and workflows within hyperspace that will not roam from the device to device. And I believe that has to do with an LWS record within hyperspace, I believe. And what we found was users liked that roaming workflow. We never had to worry about someone being logged into a device and walking away. After they're logged out, it essentially logged them out of the receiver. They logged in somewhere else, it's roamed their session. But I wanted to stress that Imprivata did a great job with that roaming workflow, along with Citrix itself. So those two merged together. Hopefully, Epic will resolve that matter, and we can move forward in that step. I do know that other EMRs and EHRs, they will work with the roaming workflow in both the published application and a VDI environment. So I just want to bring that to everyone's attention. That's the only reason why we're not doing that. And you can see up here at the top here where it says Epic Generic ID. That's just the ID that's logged into the device itself, which then pass-through authentication into the receiver.
Okay, what this is showing on this one is the workflows. So when a user in our ambulatory clinic starts up Epic, the first screen they see in Epic is to select their department screen. And you'll see that also on the acute side. But the difference what you get is in ambulatory, when a user locks the computer by hitting the F4 button, it will secure the Epic session. And in acute, we actually will log them out if the second person logs in. So the workflow in ambulatory, basically, the nurse normally goes in and checks the patient in and updates the chart, and then she'll hit F4 to secure the the session. Then the doctor will come in behind her and lay his finger down. When he does that, Epic will unsecure and then log the doctor in to the chart for that patient. In our acute facility, it was decided by the upper management that they did not want to secure the Epic chart because it's a total different workflow where the second user going in behind the nurse may not want to be in that chart location. And also, the issue we had in acute is you could have a patient in a room and they could be charging on them, and then that patient may get discharged, and they put a new patient in that room, and all of a sudden you got the wrong patient up on that computer. So that's why we decided we would just between users in the acute facility just log the first user out and log the second person in, and they just select their department and move on.
Now, as you see here, the first screen for ambulatory and the only screen for acute, the users, that's the first thing that they will see because Imprivata is passing through the credentials. So the users don't even get prompted for their password. It just passes straight through into this option. Now, one of the great things about Epic, which helps us in this particular workflow, is Epic allows the roaming of an individual user. So as John was saying, for the ambulatory, the nurse would log in, she can lock that patient, and that doctor can pick up in that same Epic session that patient, but be logged in as him or herself. And that's a benefit of Epic, which really helped us to allow to not worry about the roaming flow workflow at this moment in time.
Okay, this screen shows what a user will see when a device has been idle for 10 minutes. They'll start seeing the screen will fade to this. They'll show what users logged in. It'll give them a countdown. And this countdown starts at 5 minutes, and then after 5 minutes, it'll go back to the Imprivata login screen. And this just gives the user a chance to either wiggle the mouse or tap the keyboard, and the screen will go away, and they'll be back to their main Epic window, and they can continue where they were.
And so this is what they'll see after that 1 and 10 minute mark that we referenced on, I believe it's slide 2 or 3. And that's just letting them know, hey, you're getting ready to log out. I kind of think of it as the equivalent of a XenApp little box that comes up that says, hey, you're about to get logged out in 2 minutes. Do you want to continue your session? It's a great notification for our users to be aware as to them locking out, also which user is logged in. So that this kind of helps inform everyone who's around. As you can see, you can also modify this page. John's put a really helpful little blurb at the top there in regards to our help desk page in the event that any issues do arise. Because unfortunately, issues do arise from time to time.
This is a high level of some training acceptance issues we had. Our corporate training department didn't think it was necessary for that to create a formal training class or a document for this because they felt it was easy enough for someone to pick up. They wouldn't need any formal training. Unfortunately, we have a wide range of ability, and we had certain people that just struggled with it due to that. It was new. And so we had to spend a lot of time with some units and some clinics just to get them up to speed. We ended up using train-the-trainer. Again, this had mixed results, mainly because if you had a trainer that you trained that was really sharp and knowledgeable and motivated, they were willing to go out and train their fellow workers. And yeah, we had some that they learned it but weren't willing to share the knowledge with the rest of the staff, or they didn't understand it, didn't feel comfortable asking for clarification on how it worked, and so bad information got passed on. And then one of the biggest things we had to do is more of a workflow training. Had to teach the users that when they were done with the computer, just hit the F4 key or tap the badge just to lock the computer screen before they left the workstation. Where previously, before we had Imprivata, they would just hit the log out button in Epic or secure in Epic and walk away. But with Imprivata doing the passing credentials into Epic, that wasn't good enough once we had Imprivata in play. So that was the biggest hurdle for us, at least that I saw, to get users trained. Acceptance, you always have the people out there, especially in the medical field, who don't want their cheese moved. So we changed our workflows and they really weren't happy until they saw the benefits of it, and most of the users were grateful for not having to enter their credentials every time they walked up to a computer. Like I said, most of the resistance was due they didn't understand the benefits of the workflow, how we improved it, and now that it's been out there a couple of years, they're understanding the time that we're saving them. And right now, the biggest frustration we see is when we encounter an issue, and it takes a while for us to determine what the cause is, and because a lot of times we have to get the log files up to Imprivata for them to do their analysis and to give us guidance on how to fix the issue. And hopefully they don't come back with the one, well, we need to upgrade to a newer version. But that's our biggest frustration is for the users, if they don't have the patience to wait for us to do a thorough analysis to fix the problem. They want the problem fixed instantly.
Yeah, and that's something we'll talk on here on the next slide in just a minute. But the troubleshooting within Imprivata itself, the product itself has done a really great job for us. But there are some pieces that really kind of handcuff you and make it very difficult to troubleshoot. But we'll talk on that here in just a bit. I can tell you that from a Citrix side, we as we talked about on one of the earlier slides, we have an Epic connector installed on the servers that are running Epic, and these are specifically the XenApp servers. And that the issue that we ran into there was that particular connector seemed to cause a lot of issues with specifically our 6.5 environment. 7.6 not so much, but our 6.5 environment to the point where it was almost crashing our servers. And basically the only guidance we were given from Imprivata was to upgrade to the newest version. And we'll touch on that in just a little bit. But outside of those hindrances, everything's gone pretty well. Helps if I change the slide. Okay. So this kind of goes hand in hand with the acceptance and the training. So one of the some of the pros that we had was at the end of the day, the users did have less clicks, and in some instances, no clicks to get into Epic itself. Users seemed to be very happy with that. It made them much more productive. There was some learning curve, but once the users kind of got over that, everything went just fine. I kind of like to compare this to implementing a new EMR, a new EHR, any new application. People always complain about it when they first get it because it's different. Well, the minute that they learn it and something's wrong with it, they're complaining that they're so used to the new workflow that they can't do their job without it. And that's pretty much how we've, correct me if I'm wrong, but that's pretty much how we've gotten in our environment. If Imprivata isn't working, people just think it's the end of the world. Even some of the old school doctors who would much rather have paper. So, this is really kind of brought most, if not all, of our entire environment into the 21st century. The users no longer need to remember their passwords. So, as John mentioned, you do need to put it in, but it's a much quicker badge in, badge out. You don't have to always put it in every single day. One of the issues that we used to run into with other applications and simply logging into our Citrix environment was users would have the caps locks on, and they'd put in their password one time, they'd come back, put in their password, it's wrong, caps lock, or they mixed their passwords up, and so now they're putting in the domain password instead of their Epic password, which now these are synced. But so this seems to help with that scenario. We don't get as many calls in regards to that. Because of the number of lockouts that we have in place, the Imprivata lockout at 1 minute and then 10 minutes, and then the Epic lock at 20 minutes, and then the Citrix logout at 1 hour and 3 hours, and this has really helped protect our PHI. It's been great. I don't know of any issues that we've had so far. I think we had some at the very beginning with configuration, but other than that, I think we've been pretty clear. Fast and secure access, that kind of goes without saying. That's Imprivata's whole goal and plan. We've been very happy with that, and the increased productivity. Users aren't having to wait for their applications to launch. Epic's already launched for them in the background. Another couple pros that we don't have listed on here, as far as working with Imprivata versus other single sign-on solutions, and John can probably add more to this than I can, but if you were to work out a workflow to pass through the credentials, hit OK, log in, select something, to do it with other applications such as Centillion, which is what we had before, it was a very lengthy coding process, essentially. With Imprivata, it essentially grabbed the screenshot of the app and could do the steps pretty seamlessly. Is that?
Yeah, it does it. They have an API that, or utility that basically does a screen scraping. It'll grab the location on the screen for the user ID and password goes, and where the enter button is, or how you submit that form to pass the credentials to the application. And it's, for the most part, fairly simple and pretty straightforward. You don't have to do a whole lot on the back end after you got the basic workflow down. It's pretty quick and simple to create a single sign-on application profile.
Yeah. Now, with everything that we've done, we've had like I said, we've had a great workflow and great experience working with Imprivata, but there has been some cons that I feel are pretty important to stress here. It restricted our storefront and receiver upgrade. So when we first went live with Imprivata, we were in the process of also rolling out storefront and upgrading to receiver. I believe it was 4.0 at the time. And while we were in that process, Imprivata at the time did not support anything above Web Interface 5.4, and it did not support anything above Receiver 3.4, and you had to use it in a legacy mode situation, pretty much equivalent to the online plugin. I do know that they still have some restraints. I know we had to enable legacy mode on storefront in order for some pieces of Epic with Warp Drive to work, but Imprivata itself has been able to integrate pretty seamlessly with storefront. And the receiver upgrade, we're now at 4.3. I do know that they do have limitations going up to, I believe, 4.4 cumulative update 1 right now. Now, the receiver upgrade restraints really come into play, and then John, keep me honest, when you're trying to utilize the API. So that would really be more of a fast user switch, correct?
Correct.
Okay. So we're not using that in this environment. And again, that has to do with the constraints we have with Epic not being able to roam. So we didn't have to worry about those APIs. This did initially set us back by about 6 months for the rollout of the receiver 4.3. So we went from going to roll out 4.0 to 4.3, and then going from storefront to 2.5 up to 3. So that was a constraint there. So you do have to keep that in mind, specifically the receiver. Again, that didn't affect us with the APIs. It did affect us with the version of Imprivata we were on at the time, but API-wise, you just kind of need to keep an eye on that. We did run into issues with some session stealing if the same generic ID was logged into 2 devices. So essentially what happens is our desktop team would roll out devices, whether it be desktops, then clients, laptops, etc. And we would assign a specific username, and that would auto-log into that device. Well, at times, it doesn't happen often, but there would be the same generic logged into both devices. essentially what would happen is the session would essentially play ping pong. A user would log in on one device, be working fine. They log in device B, and that session would get stolen and go to that location. Then we'd start getting calls from the support center, and a user A would try to launch Epic again. It would steal it back from B, and so on and so forth. So I was able to use Director and look in there and just find a history log of where that user ID was launching the session from, and point it out to our desktop guys. And essentially, that was just a matter of them kind of keeping a better tabs on which user IDs were used at which devices. The next issue we ran into was users logging to devices as themselves. So you can lock down an environment as much as you want and make it as secure as you want, and you can make sure that there's only one way to get into your thin clients. I think many of us on here have dealt with this before. Essentially, there is for many thin clients, or if you have an auto login set, holding down Shift will prevent that from auto logging in. Basically, an end user, doctor, nurse, etc., sees anybody use that workflow to get logged in as someone different. They immediately do that exact same workflow. So we have had users who have been individually logged in at 5 or 6 different PCs across the environment. That was the only type of security risk that we really run into, because at that point, users are still getting prompted with that same login screen as they were, but they're authenticated into the receiver as the user who logged into the device before. Not a whole lot we can do about that, unfortunately. I think our desktop team has done a lot to try to prevent that, but as we all know, if somebody knows a workaround of something or finds a workaround, they're going to use it. And so that's basically what's happened there. It's not something that happens really as much anymore. It did at the beginning. Again, that was part of the learning curve with everybody. And the last piece that was a con, and John kind of touched on this, was that there's constant Imprivata upgrades to address issues. And I'll let John talk about that for a minute.
Yeah, we have found that when we first started implementing Imprivata and trying to get it set up, we would encounter issues, and then we'd be told, well, there's a new hotfix out there that addresses that issue. Well, in our environment, it wasn't simple to just implement a new hotfix because we just are too large, and it's just too complicated to roll out, especially with using the thin clients. But what we have come to realize is Imprivata tends to release a hotfix on the average one a month. And so we just try to get the one that fix our most critical issues and get those in place. And going forward, now that we have Imprivata rolled out to our whole footprint, what we're going to do, the plan is to do an upgrade at least once a year, and if necessary, twice a year, because it won't take as long to do the upgrade as it does during the initial implementation.
And I think that would be the biggest drawback that we ran into, was just, it was always pull logs and then upgrade. The upgrade sometimes would fix the issue, would cause another one. Sometimes it would just simply fix the issue. I think they've gotten better with that with time, but still, that was one of the cons that we had. And I'm just not a big fan of doing a full upgrade to address one issue if there's a workflow that we can put into place to address that. But yeah, so that's kind of our environment. There's a lot more that I could go into and John could go into. There's only so much time, and we try to cram in as much information as we have. We're going to, I guess, open up the questions here in a minute, but if we do talk about anything or we don't talk about anything, or you want to share some of your experiences. The healthcare SIG, please join and share. That's pretty much what we've been doing, talking a lot about things like this. And we're at the early phases, but we're starting to get some traction there for these specific situations. So, but yeah, so that's basically our environment. And I guess I'll turn it over to questions if anybody's got any questions for us.
So we do have some questions coming in. Let me pop this out so I can see them a little better. The first one I have is, have you had a problem with the badge number sequences from different vendors or duplicate numbers?
Not so much with the badges, I believe. I'll let John speak to that.
Yeah, we have a standard vendor for all our badges, so we haven't had any issues with the badges getting enrolled. We did go through a process when we first went live to enroll all the badges ahead of time so that each individual user would not have to. And we had to work with Imprivata on a Excel macro to convert our badge numbers to what they would read and how they would be converted when they enrolled them manually. But other than that, no, we haven't had any major issues with getting badges enrolled.
Okay. Let's see. Let's look at the next one. Just curious, do you guys use Imprivata's secure messaging product?
Not at this time, no.
All right.
We are looking at it, but our current goals right now in our budget, we're not going to look at it to implement anytime soon.
Okay. Let's see. Next, how did you find getting the Imprivata agent client onto devices like your HP and Weiss clients?
We have a team that supports the thin clients, both the HP and the Weiss, and they use they have a console associated with them and they build a push pack. They're able to push to them, and this is what really slows down any upgrade and implementation for us, because we have the right filter turned on when they're in production. So in order to do any updates, push package has to first turn off the right filter and reboot that device, then make the change, and then turn the right filter back on, reboot the device. So that alone takes time. And then our acute facilities, which are 24/7, if someone goes up and does something on that thin client while the upgrade's happening or the install's happening, they can break it very easily.
Yeah, that's an issue that we've run into, and John's absolutely right. I know that HP has a management tool. I think our Weiss, for our Weiss clients, I believe they were simply updating the image and pushing that out. No matter how you look at it, it's not a clean process. This is where kind of a VDI environment would come into play, be much more beneficial. You simply upgrade the client and push out the image to be published, essentially, and that's it. But yeah, that's the biggest headache that we do have. For our desktops and laptops, we just use SCCM right now, and that'll push out any updates that we need. But yeah, the thins will literally take us weeks to push out, where it could take all of our desktops and laptops a day. So.
All right. Let's see, next question. If you have any workstations that do not have the Imprivata client, do they have issues connecting to the same XenApp farm?
No, not at all. No. So we use a Passthrough Authentication. So whichever user's logged in just authenticates into the receiver and connects in just fine. The only difference is they will be prompted for their credentials into Epic. Now, one thing I want to stress with our setup is that the desktop itself and the thin client will actually authenticate into that user ID. So that generic ID that we have, then essentially bring up the OS, launch the receiver, authenticate into the receiver, and then at that point the Imprivata splash screen comes into play. So the workstation itself is following the same workflow as a workstation that does not have Imprivata involved. The only difference is there's Imprivata splash screen to basically just simply store your credentials for Epic to pass those through. Is that correct?
Correct.
Yeah.
All right. Let's see, we have one more question here. Are you also using the account self-service features of Imprivata?
Repeat that one more time for me, please.
Are you also using the account self-service features of Imprivata?
No, we have another product that does the password management that controls all the password changes for Novant Health, so we did not implement that through Imprivata.
Okay, that was my last question, unless there's any more to come in.
Stephanie, there's actually one here. Somebody mentioned just a simple Reg Key.
Oh, okay.
And I believe that's in reference to the session stealing. So I know exactly which key is set here. I think we have that actually set to 3. So basically what we wanted was that in the event that the receiver is refreshed or Windows is refreshed or anything along those lines, any sessions that may have gone into a disconnected state to come right back up. And we didn't want the users to have to click anything. So that setting there was set to 0. This is the if you go into HP Local Machine Software, Citrix, Dazzle, WSC Reconnect mode, and you can change those settings. I think one is don't ever reconnect anything. One is reconnect if receiver is opened, refreshed, something along those lines. But yeah, so we have it set up so that whenever you log back into your device, even if it's across the board, also at a device not using Imprivata, if you have a session out there, it will auto-connect for you. And so we wanted that to help our users with the workflow and speed their process and make their workflow and their experience a little bit more seamless.
All right, I see he responding that makes sense.
Yeah, and I mean, it doesn't matter how you do it. Each environment's different, as I said at the very beginning.
Gotcha. Looks like another question came in. What have been the results as far as patient care satisfaction, reduction of data entry mistakes into wrong records, etc.?
I've got it right here. We can read it.
Okay.
So basically, how's patient care compared to before and after Imprivata was involved, and how's it been with the reduction of data entry and mistakes of wrong records, like putting information into wrong records?
I think it has helped because we're ensuring that the right user is logged into Epic. We have reduced the ability of someone walking up to a computer and seeing the previous user's Epic session, and so therefore they're not logging in as a different user. We still get that occasionally, but not near as frequently. I don't have any data on how frequently it happens available to me, but from what I've heard from the doctors and nurses I've talked to, it's definitely helped.
I think the only issue that I know of recently with incorrect patient is that's actually been an issue on our Epic side with our ECP aspect, and that had to do with the roaming piece within Epic itself. But from an Imprivata perspective, it's actually very, very much so decreased the amount of incorrect patients, wrong information, wrong record, and definitely cut back on the data entry.
All right. That looks like the end of the questions that I have so far. So can take it back. Is there anything you wanted to say to wrap up before I close out with the rest of the CUGC info?
No, just thanks for everybody for joining. I know that there's a lot of workflow use cases for Imprivata and Citrix. If you have any questions, like I said, the healthcare SIG, please feel free to join and post your question or post your work experience. That's what it's for. It's a central melting pot of all of our brains. Yeah, that's pretty much it. Thank you, everybody.
All right. As he said, we would love to have you all join the Healthcare SIG if you're not yet a member. There is the link, and it was also put in the chat. Looks like we have a late question coming in. Let me see what it says. Oh, thanks. You're welcome. Let me.
And all of this will be posted, the webinar, slides, and everything, even the recording, on the CUGC page, correct?
Yes, absolutely. We have a link in the forums, our discussion thread in the forums, where you can talk about this, but we'll also post the recording as soon as I get it ready to go. And you'll also get an email tomorrow with a link to the recording, a link to the forum thread, and a link to join the SIG. And I just put in the chat window a link to a very short anonymous survey. We love to get your feedback. It helps us plan future webinars and content on the CUGC site. And love to have you fill that out. It doesn't take but a minute. And then if you have any more questions, please bring them to mycugc.org. We will be happy to answer them in the Healthcare SIG forum. I'm sure Dan will be glad to talk to you all about any further questions that you might have. And I think that's all for today. So thanks a lot, John and Dan. We really appreciate you giving this presentation and look forward to many more from the Healthcare SIG.
Great. Thank you very much.
Thank you.
All right, everybody have a great day.
Thank you, too.